Tuberculosis is a highly contagious and deadly infectious disease. Primarily affecting the lungs, patients with an active TB infection can experience cough, chest pain, bloody sputum, weight loss, and fatigue, among other symptoms. Latent infection can also occur if the patient's immune system is able to sequester the bacteria in protective bubbles called granulomas. Many patients with latent TB never experience an active recurrence, but patients who are immunocompromised are at high risk for developing infection. This is a concern in patients with diabetes, cancer, or HIV infection. Tuberculosis is diagnosed with a series of tests. This includes a TB skin test, in which antibodies for tuberculosis are injected cutaneously and the immune response is recorded. A positive skin test may lead to further testing, such as a chest X-ray and lab analysis. Researchers looking at data over an 8-year period have found consistently higher incidence of TB among Nycha residents. Nycha TB patients were also more likely to be older, female, Black, and/or US-born than non-Nycha residents, indicating that this population has a unique relationship to TB infection. TB infections resulted from a wide variety of mycobacterium strains in Nycha residents, which suggests that the high rate of infection is not due to disease spread in Nycha housing, but rather is the result of comorbidities and other risk factors. The New York City Department of Health offers free testing and treatment for at-risk patients at 5 CHEST centers across the city. The Department of Health also offers directly observed therapy for TB patients. Through this program, a healthcare provider assists with medication. Though these services are free to all New Yorkers, CHEST centers require appointments in advance, and patients are usually required to return for test results. The locations where TB testing and treatment are done are limited, presenting accessibility issues for many patients.
So what is NYCHA? NYCHA stands for New York City Housing Authority, or more commonly known as the Projects. NYCHA is the largest public housing authority in North America and is home to 1 in 14 New Yorkers. In fact, if NYCHA were a city, its population size would be about the same as that of Miami. Notable former residents of NYCHA include Howard Schultz, the CEO of Starbucks, Whoopi Goldberg, Justice Sonia Sotomayor, and Jay-Z. But despite these statistics, the image associated with the projects is not a good one. NYCHA complexes are known to be old, extremely run down, poorly managed, and ridden with crime. Many of these complexes suffer from poor infrastructure, with many having high amounts of lead as well as faulty boilers. Just walk down Malcolm X Boulevard to 112th and you will find King Towers, a NYCHA complex here in Harlem that just last week suffered from no heat or hot water during last Wednesday's snowstorm. Aside from the issues with infrastructure, NYCHA residents are plagued with poor health. They are a community with disproportionately high rates of TB as compared to the general population. Studies have shown that TB rates in the US have dropped significantly. However, it continues to affect marginalized populations. The 2 major populations amongst which TB persists are immigrants and NYCHA residents. Our campaign will focus on TB within the NYCHA community and how we can help to eradicate this disease. In a study done from 2001 to 2009, it was found that the TB incidence among NYCHA residents was twice that of non-NYCHA residents. Also, 259 unique strains were found amongst 364 NYCHA residents. So what does this mean? Well, a low strain diversity would suggest transmission among residents. A high strain diversity, which is what was found in this study, suggests that the transmission happened through other means. So to reiterate, transmission of TB does not seem to occur within the NYCHA community from one resident to another. Despite this, the population still has a relatively high burden of TB. Therefore, they should be engaged in ongoing TB prevention activities. However, because public housing residents tend to have more health issues than non-public housing residents, TB reduction efforts should be conducted in conjunction with other health promotion activities.
Don't you think that patients like me and you would rather go on an app and fill out information instead of those long, boring forms in the doctor's office? We have created a smartphone app called MedSage. MedSage would serve as a HIPAA-compliant liaison between the NYCHA community, private practices, and local medical facilities. This app would allow residents of the Nycha community to receive monthly reminders of their upcoming visit in their primary clinic. With the approval of the physician caring for the patient, their diagnosis, and the history of present illness, it'll all be recorded and explained by the physician in a simple way via voice automation. To allow the patient to truly understand what is required of the patient outside of the visit to take care of themselves. We have an automated system that directly connects the facility to the patient's phone via personalized app. It keeps track of how many times the patient responds to the medication reminder, selecting yes or no, and to how many pills they took that day. For example, with tuberculosis, common treatments include isoniazid or rifampin. In the event that there are contraindications to the drug, MedSage not only gives daily reminders and proper administration instruction to the medication, it also connects to approved sources from the physician to explain how to improve one's health at a level that's easy to understand. If the patient is not adhering or understanding what the necessary steps to properly administering the medication is, then the facility would get in contact with the patient after one misadministration period. For all you non-readers, such as myself, have no fear. MedSage app is here.
One worry about our program is that Nycha residents may not have access to our services. However, according to a mobile service study, 95.6% of NYC residents own a cell phone, and 79% own a smartphone. Even more, 66% of Nycha residents who make no money a week still own a smartphone. Thus, a smartphone app still has the ability to aid some of New York City's poorest residents. Now, to address how we will fund our program, Mayor de Blasio wishes to allocate $250 million a year to Nycha. This is where we will receive our funding. We will ask for a total of $500,000 for our program. Out of that $500,000, we will use $55,200 to pay for our smartphone app and to maintain it. $200,000 will next go to paying for MedSage employees. We will have 2 full-time employees that are in charge of administrative duties that will each be paid $54,000 a year. We will also have another 4 part-time employees that will earn $24,000 a year. The part-time employees facilitate meetings at each of the Nycha resident communities to help residents understand how the smartphone app works and to answer any questions that they may have. These meetings will be free to the community and will offer free food to those who attend. $100,000 a year will be allocated just for these meetings. Finally, we will offer an incentive program to keep residents interested and active in our smartphone app. We will offer gift cards to local grocery stores and shopping centers for every 6 months they are actively using our app. This will be funded by local NYC sponsors.
MedSage allows Nycha residents the ability to track and monitor their progress outside of their doctor visit, as well as keep in contact with their physician if needed. Now, you may be wondering, how will MedSage stand out from all the other competitors? Well, we have a solution for that, and it is our incentive program. Our incentive program ensures that the residents receive benefits as they consistently use our app and comply with their physician's orders. Our incentives will include the opportunity to be provided with affordable groceries via gift cards through our affiliations with local grocery stores throughout the 5 boroughs, and care packages which will contain necessities that are needed by the residents. How will the incentive program work, you may ask? Every time a Nycha resident logs onto the app, they will be given 2 gold coins. As time progresses and they are consistent with their treatment plan, they will be given 3 additional coins. However, the physician must first approve. This will ensure that they are being compliant with the physician's orders, and it is also an additional way for us to try and make their lives better. Every 2 to 3 months, the app will automatically calculate their coins, and at the 6-month mark, they will be given the opportunity to choose between affordable groceries through the local grocery stores and or other necessities that they may need.
It's clear that tuberculosis is a highly contagious and a deadly infectious disease. Here in Harlem, home to North America's largest public housing, it's upsetting to see we're still yet so far from eradicating this disease. In today's times, technology is everything. Our MedSage app is just the very beginning to use the very soul of our existence, our cell phones, to be able to find a way for a more promising future. Today it's TB in the Nycha community. Tomorrow, well, we'll leave it to your imagination.